I want you to imagine being 5 years old. You're sitting in a classroom, your teacher writes letters on the board, and your classmates start reading them out loud. But to you, those letters look like smudges. You squint, you lean forward, but no matter how hard you try, the blur doesn't go away. And this is what you see. And eventually, after this happens more than once, your parents and teachers come to their own conclusions. Maybe you're not paying attention. Maybe you're academically challenged. Maybe you're not trying hard enough. But the truth is far simpler than that. You just can't see. I know this feeling personally. My name is Layla Abukhdeir, and I've been wearing glasses since I was 18 months old because I have a condition called amblyopia, commonly known as lazy eye. Amblyopia is very common in young children, and without proper treatment, it can worsen to the point of vision impairment because the brain shuts off one eye. It's especially important for it to be treated below the age of 7 because children's visual systems are still developing. Because someone caught my amblyopia early enough and took the steps to get me treatment, I am able to see clearly for the rest of my life. But not every child has that opportunity. And the consequences of that don't just affect a child's vision, they also affect a child's future. Here's the reality. Conditions like myopia, astigmatism, and amblyopia are extremely common in children. According to the NIH, amblyopia alone affects roughly 5% of all children in the United States. The American Academy of Ophthalmology found that 52.4% of childhood blindness is caused by preventable conditions, meaning that children had conditions like amblyopia, and they were either not treated in time or not treated at all. And here's the thing, most children don't realize that their vision is abnormal. If a child has always seen the world as blurry, they're going to assume that the blur is normal and they're not going to complain. So unless parents actively look for the signs of a vision disorder or they take their child to get screened regularly, that child's health could go right over their heads. And vision matters because learning is visual, especially for children. Things like reading, writing, copying letters down from the board, recognizing letters, and focusing on books, all of them require clear vision. Johns Hopkins University found in one study that when they gave children the glasses and the prescriptions that they needed, they performed measurably better in reading and math. Yet despite how important vision care is for children, millions of children around the United States still go untreated, which raises the important question, why? One major factor is socioeconomic inequality. In the United States, children from low-income families are significantly less likely to receive vision services. In the 2021 National Survey of Children's Health, which is conducted by the Department of Health and Human Services, it was found that 47% of children had not received a vision screening in the last 2 years. They also found that children from families with a lower income, less access to health care, no health insurance, or lower parental education were significantly less likely to receive vision screenings or eye care. Think about what that means. 2 children might sit in the same classroom. They have the same teacher. They read from the same textbooks, but they perform different academically because one of them sees clearly and the other doesn't. Not because of ability, but because of money. When we make access to vision care dependent on a child's financial situation, we are putting them on unequal footing from their peers before the first lesson even begins. And sometimes the issue isn't even a parent's income, it's their misconceptions about vision care. Many parents believe things like, my child is too young to need glasses. My child would tell me if they had something wrong with their eyes. They passed the vision screening once. But the reality is that a lot of eye conditions might not show obvious symptoms because children are smart. They adapt, they lean forward, they memorize, they guess. And unless a parent is actively looking for signs of vision disorder, they could miss it. And with time, that vision disorder could worsen and eventually cause permanent damage to their child's eyes. In other words, waiting until a child says something is wrong is often waiting too long. So if many parents don't know to look for a vision disorder, and many families lack access to vision care, where's the one place that almost every child goes every single day for 12 years of their lives, free of charge? If you guessed school, you'd be correct. Schools are one of the most powerful yet overlooked public health tools in the world. A school-based vision screening has the potential to find children who need glasses and treatment early so that they can receive that treatment promptly and effectively. However, current policies are inconsistent. Currently, 6 states in the United States require vision screening annually or biannually, which is ideal. 4 states recommend but do not require any sort of vision screening, and 6 states don't recommend or require vision screenings at all in schools. The other 38 states, including Maryland, require vision screening in at least 1 grade, which is not ideal. In Maryland, we require vision screenings in pre-K, 1st grade, and 8th grade, leaving a huge 6-year gap between 2nd and 7th grade, during which a child could develop a vision disorder but not receive the proper treatment because their family doesn't have the access to it. That's why we need stronger legislation implementing more frequent school-based vision screenings. Because when we give every child the opportunity to see clearly, we're not just improving their education and their confidence, we're also giving them the opportunity to put their dreams in motion. Now, hopefully, if you're a parent in the audience, you're wondering what you can do for your child's vision right now, because legislation takes time, and your child's health is a priority. Here are a few steps you can take as soon as you leave this auditorium today. Number 1, schedule regular eye exams for your children. Not just vision screenings, but actual appointments with a pediatric ophthalmologist, even if you don't notice anything necessarily wrong with your child's eyes. Which brings me to number 2. Look for signs of vision disorders in your children so that you can bring up your concerns with your eye doctor. Look for squinting, drifting, or crossing eyes. Number 3, take school screening results seriously. If your child fails a vision screening, whether it's at school, at their physician's office, or in a physical, take the results seriously and take the actions to seek treatment for them so that they can see clearly. And last but not least, and arguably the most important, take glasses seriously. There's no point in carrying out the first 3 steps, recognizing that there's a problem, booking an appointment with the doctor, and following up with your concerns if you don't make sure your children are benefiting from the glasses they're wearing. If they have glasses, make sure they wear them as often as possible. Now, let's go back to that 5-year-old, sitting in a classroom, staring at blurry letters on a board. That child could be anywhere, in any city, in any school. They could even be sitting next to your child in class right now. The difference between a child who is successful in the classroom versus one who's not could be something incredibly simple: a pair of glasses. I know this because glasses changed my life, and my parents, after noticing a problem with me, sought treatment for me, and I've been able to see clearly for the last 15 years. I think every child, no matter who they are, where they are, or how much money they have, deserves that same opportunity. Thank you.